Do you know that antacids can damage your kidneys? Antacid, I mean omeprazole, and some proton pump inhibitors can damage your kidneys. Your normal antihypertensive drugs, ACE, can damage your kidneys. So, but there are times when you need to take these drugs. I mean, what are you going to do? So in this video, I will tell you about 10 classes of drugs that you're taking that can damage your kidneys. And for people that doesn't have an option, how would you take it so that they don't damage your kidneys? For example, people that are on hypertensive drugs, so you can't stop taking those drugs. Okay, so if this is your first time here, by now you should have liked and clicked on the subscribe button. Please do not skip at any point, because you don't know the part that you skip. There may be something very important. You all know that I take my time to teach, okay, and I try to make it seamless in a way that you will understand. So let's get to the number one class of drug on the list, which is the one I mentioned, the antacids. Excuse me. Antacids in the class of proton pump inhibitors. Now, this is not me, okay? This research that is on the screen, as you can see, found out that antacids, especially the proton pump inhibitors, okay, the one that has the aluminum salt and all, they find a way in damaging your kidneys by causing causing a reaction, like an allergic reaction to the interstitial filtering system of your kidneys. So your kidney starts to swell, okay. The glomerulus, those filtering, fringe-like thing that filters wastes that are in your kidneys, starts to swell. And if you continue to do this, you can develop acute kidney injury. Now, if your kidney is already having issues and you are taking these antacids, these classes of antacids, it will make the kidney damage rapidly, okay. So probably you had an acute kidney injury, or your kidney is probably you're at first stage of kidney failure and you're consuming these antacids, your kidney will damage very quickly. For those that don't have kidney issues, this can predispose you to having acute kidney injury. Okay, please be aware of this. Now, what do you do in the instance of when you're being prescribed this this drug? Most of you have the habit of, when you have a little bit of indigestion, when you feel your stomach is aching you or anything, you just go and buy antacid in the market, omeprazole in the market. You have ulcer, or your doctor has not refilled your drugs, you just go and buy and take. You have to stop that habit. This is why you have to work with health professionals. Don't put laws into your hands. Now, if your doctor is treating you, there are some certain points they send you to some certain types of tests to check your system, to check if probably there's been something going on in your kidneys, or the level. There's what is called the trough level. Okay, there are times as I'm talking to you now, I will still mention some other drugs too, that, for instance, lithium, they will be checking you. There's a level it will get to, and your doctor will stop. Or probably if you're already having some issues in your kidneys, your doctor can switch, okay, or change some drugs for you. There are some things that you too have to do. For instance, those that are already for people that have ulcer, or have indigestion or GRD, you reduce the way you take fatty foods, because these are the things that causes more production of acid, which will give you that heartburn or burp feeling. Reduce your fatty foods. food that are highly gaseous, for instance those that still take beverages that has lots of gas in them, for instance Fanta, Coke, all of those things that has a lot of gas in it. You, after eating, you don't lie down immediately. There are so many things you have to do. I don't want this video to be unnecessarily long, so that you don't keep taking this drug all the time. Things that trigger your ulcer or trigger your heartburn, please, you try to avoid it. Like I said, I used to tell people, drug is not the best thing to do. It's just that we don't have option. So when you have an issue, don't rush to take drugs. Try to manage it conservatively first. If it doesn't work, then you can now opt for drugs. Let drug not be the final options for you, be the first option for you, because it's not a good thing. Having known about that, the next number 2 on the list is, because I'm starting with the drugs that is angiotensin converting enzymes drugs, ACE drugs, ACE drugs, which are a class of anti-hypertensive drugs. Now, some drugs, most antihypertensive drugs can actually damage your kidneys, but it takes a long time. There are also some that will not damage your kidneys, but there are some that, because of the level of your blood pressure, it needs to be administered to you so that it will bring the blood pressure low. So you have to be careful. What do you now do to help? Number 1, you have to check your kidney function. If you're hypertensive and if you're diabetic, try to check your kidney function test. At least check your kidneys, at least 2 times in a year. Whether your doctor sends you or not, send to your doctor. But I'm sure your doctor will send you. Now, this will help your doctor to find out if anything that is happening, any abnormality, because kidney failure does not show symptoms. If you are in this page, you should have known by now. You will not know, God forbid, as somebody is not me. The person may be having kidney failure, and I'm okay, talking, going to work, nothing, no symptom, until the last point, when you start feeling the symptoms, your legs start swollen and all, the person, when you now go to the hospital, the kidney has failed. But if you know earlier, it can be salvaged and it can be stopped by doing some certain things, which, if you want to have a consultation with me, click on the link on my bio. I'll still try to put a number on the screen, on the description box. You want to have a consultation with me, or a nephrologist, gynecologist, you're a man, you're having low sperm count, urologist, anything. We have all specialists, doctor that's on ground to talk to you. You book a consultation with them. You pay on WhatsApp, and then you'll be given time to call the doctors. And of course, if there are tests you should do, they will tell you to do them. Same thing as me. So it all depends. It is not free, please. Now, having said about that, you also try to start managing your blood pressure by yourself. How? We have a video on how to bring your blood pressure down naturally. Please locate that video. We'll still put it on the description box and watch it. You have to, start reducing your salt intake, and there are ways, because you can't, no matter what level of blood pressure medications you take, as long as you're taking so much salt, it will not work. So if you start managing your blood pressure naturally by yourself, your drugs naturally will start reducing. Your doctor will start reducing your drugs, because he will find out that you are now seeping into hypertension, because the thing, your blood pressure is starting to normalize. But this doesn't mean that you stop taking your drugs. But when you start managing yourself by the things you eat, like I said, every option is not just drugs. You people should know that. If you can manage yourself with food, natural things, you will live more healthy. So by the time you start managing yourself, your drugs will now start reducing, and thereby you start protecting your kidneys. So by yourself, you're trying to reduce your blood pressure, you'll still be taking your drugs. You now find out that if you used to take 4 different drugs, your doctor will start reducing it from 4 to 3. And then if you used to take 3 times in a day, from 3 times in a day to 2 times, from 2 times to once in a day, gradually, thereby reducing the workload on the kidney and also on your liver. That case being explained. The next drug on the list is non-steroidal anti-inflammatory drugs like ibuprofen, diclofenac, or Panadol. What is the name of this drug that women use for their menses? Felvin and all. Now, we also have paracetamol, which is not an NSAID, but it can also damage your kidneys, especially paracetamol. It can also damage your liver and also your kidneys. Please be aware of this, okay? So these drugs, you shouldn't take them for a very long time. It shouldn't be taken for a very long time. So it's not something that when you have headache, you go and take. Before you have headache, find out what is causing this headache. Have I slept today? Have I drank a lot of water? Am I stressed? If you've done all those things and the headache is still there, you can go ahead and take the paracetamol. You take the paracetamol or ibuprofen or whatever today, tomorrow, this headache still come, the fever still come. You have to stop, find out what is causing the headache, and then treat the cause instead of the symptom. Because when you continue to treat the symptoms, which is the fever, the headache, you're not treating the cause. It will still be coming probably after some days, and you're killing your kidneys and your liver. So for those that have chronic pain, these drugs that I mentioned, nobody will give it to you for a very long time. So your doctor may not know that you're having chronic pain. Your doctor may just give you these drugs to take for 3 days or 4 days, thinking that is it. But what you go after taking that drugs, instead of you to go and tell the doctor that the pain is still there, because you don't want to pay money, or you don't want to, you feel the hospital sold the drug for you that is expensive, you now go back to the chemist and you buy the same drug. Who is fooling who? Now this drug, you now feel because your doctor gave you, he stopped, that means you continue to take that drug. That is the wrongest thing to do. The doctor gave you that drug to help relieve that pain at the moment, thinking is a normal, so probably something happened, a sprain or something, and that's why he gave you for that specific amount of days, not for you to continue to take it for months. No. If the pain didn't stop, tell the doctor, please. I mean a qualified health personnel, a qualified, not quacks that are in the chemists. Be aware, these people have damaged people's kidneys. I don't want this video to be unnecessarily long. I would have told you a story of how God used me to save somebody that he had taken those pain medication, no two ways about it, he would have had acute kidney injury. Please make sure you talk to a qualified health personnel. So now, let's say the doctor now found out that you have, this is a chronic something for people that have migraine, or people that have cancer pain, or chronic pain is a pain that is very long, that it doesn't stop. It's like it takes months. Doctor will not give you these drugs that I mentioned, diclofenac, ibuprofen, because they will damage your kidney. There's another class of drugs used in managing pain that does not damage kidneys. Are you seeing where you are wrong? So the doctor will, by that time, would have known that, and these drugs, they can't sell it to you at the pharmacy. They are controlled drugs. So the pharmacy won't even give it to you. It is prescription drugs. So the doctor would have known that these are the cause of this pain, and this person, you need to manage your pain for a long time. The doctor will now prescribe those drugs for you. Knowledge is power. The next drug on the list is antibiotics. There are some antibiotics that you don't take. For instance, vancomycin. There are some antibiotics also that can damage your kidneys and can damage your liver as well. It has to be prescribed, not just prescribed. Your doctor they also check trough level, and they have to monitor you as well. Now, generally, most antibiotics should not be taken except they are prescribed. Why? Because of antibiotic resistance. Antibiotic resistance means that your body have now gotten used to antibiotics, that a normal antibiotic, let's say a tiny antibiotic that is supposed to clear an infection, will no longer work. Even a big antibiotics will no longer work, because you've been taking antibiotics even when nothing is happening, or when what is happening does not require antibiotics. So please make sure that this is prescribed, and before being prescribed, your doctor will not prescribe without asking you to run a test to find out the bacteria that is reactive to that antibiotics, so that once you take the drug, immediately the bacteria goes. No doctor will do trial and error with you by telling you. That's why people ask me for medication. I'm a nurse, nephrology nurse. I don't. The doctors don't, because they don't know the drugs that will react, that probably that drugs they are giving you, it won't work with the antibiotics. You're spending money, you're putting your organs in danger and building more resistance. Please seek professionals and stop abusing antibiotics. Now, the next drug on the list is some hard drugs, like some opioids like cocaine, some tramadol. Well, that one can has some neurological effects. It also needs to be monitored. Some of these hard drugs can also impair on your organs. Now, there are also some antidepressant drugs which I've mentioned before. There are also some drugs like lithium, and some of these drugs, please make sure that these drugs are prescribed for you. Don't just take these drugs by yourself. Now, I forgot to mention, this should have been at the top. There is, for people that have kidney stones, or you're experiencing flank pain, probably your back is paining you and you're suspecting kidney or anything, and they tell you to go and do MRI with some scan, magnetic resonance imaging with contrastive dye. I don't know how to explain it. Now, when you usually go to this kind of scan, but that scan is quite big like the normal scan, so they will tell you that they want to inject something on you. That thing is called contrastive dye. This thing can damage your kidneys. When after the procedure the person didn't take a lot of water, usually, now I've seen it happen to somebody that they did this thing for the person, and they did not, because they're supposed to give you like a normal saline, like a water in your body to flush those things out. So please, whenever you go to do this test, after, if they didn't give you the in a fluid, remind them to give you fluid. Okay, I wouldn't have said this, but I've seen it happen, and the person's pain doubled. Thank God that person didn't lose his kidneys. Now, the next drug on the list is diuretics and some laxatives. Now, there are some people that have the habit of purging. They take drugs to just purge. This is absolutely wrong. This is now bringing us to the people that sell weight loss products. Now, when you get some of these products, you see that most of them have some laxatives, some diuretics. You keep on purging and purging and purging. This thing may have effect on your kidneys. Now, when you're purging and as well urinating, you are dehydrated without knowing. You may not feel to drink water, but your kidneys are dehydrating, and your kidneys can be impaired. So please be aware of this. Stop taking all of these slimming pills, that are makes you purge, the ones that are diuretics that makes you urinate. Now, that is for it. Now, there are some diuretics that are prescribed in the hospital as well. So please also make it a good thing that whenever a drug, this particular drug, especially furosemide or torsemide or some other drugs, or that makes you pee, Always find out from your health personnel if you should continue, when you should actually stop. If you're refilling your drugs, I urge you, stop refilling your drugs via the pharmacy. Refill it at the hospital, or call your doctor and ask, my drugs have finished, should I refill them? Especially if they are not your routine drugs, like your normal antihypertensive drug or diabetic drugs. Please. So people that are on those diuretics, those drugs that make you, pee, for people that are on kidney failure or heart failure or stuff like that, make sure that once it's finished, you ask your doctors if you can continue these drugs, and when you can actually stop, and make sure you take lots of water. For those that are potassium sparing, eat potassium high food. I don't want to start explaining. So I think basically that is, okay, before I forgot, now this is the almost the last one. I still have some, but just I'm mentioning the ones that are quite everywhere that people do. Okay, this is the two last one. The other one is some antiviral drug. That's drugs that HIV people use. Of course, you know by now that if you're HIV positive, that it is not a death sentence. You can have your baby, you can give birth without infecting your partner and your wife. You just have to let your wife know and leave the rest to the doctor. Finish. So those drugs that you take, most of them are nephrotoxic, but like I said, you have to continue to take your drugs, because if you don't take your drugs, your immune system will come down, your CD4 cells will come down, infections happen. From there you may get to AIDS, which is the final stage. But what you have to do is that you have to continue to go for checkup. Check your kidneys, check your liver, continue to be checking. If anything funny is happening, please let your doctor know. They can always change the drugs for you or reduce it. But most people feel okay that they don't check. If you're HIV positive, it is very important that you have to be checking your kidneys and your liver because of those drugs. They are heavy drugs, and try to help your kidneys and your liver by avoiding those other drugs I mentioned. Live healthy, fruits and vegetables, things that will impact on your kidneys. Locate videos on 12 things that can damage your kidneys. Locate videos on how to protect your kidneys and your heart. All those videos are there. Finally, herbal concoction. I don't know how to even begin or how to end. But for my African people, especially those that are in the eastern part of Nigeria, there is this thing that is called ajumbise. I know a lot of you will come for me, but that thing has damaged a lot of women's kidneys. You may not be hearing these things because it is not the area you are specialized. For instance, now I'm not seeing a lot of birth defects. So when my colleagues are saying, when people are saying it, I hardly see them. But midwives, people, they will see a lot of things. They will see men, babies born with 3 heads, with 1 toe, those kind of things. So this is mine. People from different wards, different categories come. Ajumbise may damage your kidneys. If you're taking ajumbise, be very careful. Make sure you are checking your kidneys, and I think I have a video here on how that ajumbise may damage your kidneys. Please locate it. Another part of herbal concoction that can damage your kidney is this one that is everywhere, called abu. Also, that one I think is the northern part, Yoruba part of Nigeria too. It's a mixture of herbs. That is the worst. The ajumbise is just coming. People are just, not everybody, So the abu one is worst. Avoid abu. I have lots of patients that wants to come to my platform to tell people that it is practically abu that damage their kidneys. But because of my professional rules, I can't allow it. I wish it's possible. Probably in the Western world, they allow stuff like that. I don't know. Please, Do not say you're not told. Any herbal remedies you're taking, be very careful. And please don't take herbal remedies or herbal mixtures together with your orthodox drug, that's your English drugs. If you must, give space. These two things can interact with each other, either make your medication not work or make it work high, double, or, of course, two medications, two things. These drugs we are taking, for goodness sake, it's the kidneys. It's the kidneys, the liver. So it's more stress on them. Avoid these things. Any medication, herbal mixtures you're taking, make sure that you know what you're doing. And stop taking all of these, supplements anyhow. We'll talk about supplements on our next video, because this video is already long. So our next video, we'll be talking about supplements, and of course, those that have quick ejaculation, I've promised you people a video. I've not made a video for like in 2 weeks on this YouTube page because I've been busy. So if this video has helped you, comment, like. Remember, you want to book a consultation with me, the link will be on the description box and also on my bio. Have a nice day.